Thank you, Dr. Mahin, and good afternoon, everyone. I hope that you're hearing me well. I am audible perfectly.
Yes, Miss Ongla.
I'm audible. Okay, thank you, thank you. So I will say once again, and good afternoon, everyone, and welcome to today's important session, where we will be exploring the far-reaching implications of gender-based violence on individuals, communities, and society as whole. This conversation is part of our continued commitment to advancing the Sustainable Development Goals, particularly 3, 4, 5, 8, 10, and 16, by fostering awareness, knowledge, sharing, and advocacy to promote health, education, equality, and justice. Today's discussion will cover the mental, physical, and social health consequences of gender-based violence, its impact on community stability and public well-being, current research and evidence-based insights, gaps in our understanding and urgent areas for further study, and the cultural and structural drivers that perpetuate this violence. I am Ongla Pascaline, a Cameroonian women protection activist, Women Ascension Fellow of Community Outreach Department, a certified member of Women Ascension Organization, and Value Health Africa National Coordinator. I have the privilege of moderating this session. We are honored to be joined by Women Ascension mentor Petrina Montrose, a respect criminal justice mentor and social justice advocate from United Kingdom. Petrina brings both professional expertise and life experience as a survivor of gender-based violence. Petrina used a voice to challenge ineffective policies and to empower other survivors toward healing and action. She will explore all the sides of gender-based violence, and her insights will help us deepen our understanding of the human realities behind the statistics and what must change to ensure dignity, safety, and justice for all. Please remember to stay mute unless speaking. Use the chat for question or reflection, and most importantly, listen with openness and empathy. So we will welcome our Petrina. Welcome, dear Petrina. Thank you for accepting our invitation to share your expertise and your once again your expertise. Once again, sorry. Welcome to this session. The floor is all yours when you're ready.
Thank you so much. Hi, everybody. Well, firstly, I would like to extend my heartfelt gratitude to Mahim and the wonderful community of Women Ascension for creating a safe space for survivors to share our lived experience and ensuring that our voices are heard. My most profound appreciation goes to Women Ascension for standing in solidarity with us and showing immense compassion towards victims and survivors of gender-based violence. Your advocacy for the full respect of our human rights is invaluable and it's empowering. So I elevate my voice to highlight the oppression and cruelty that humanity imposes on our most vulnerable and marginalized individuals. Today, I stand for the thousands of survivors worldwide who have been silenced and ignored. Their stories are crucial, and we must listen and we must respect their experiences. As a leader among survivors, I understand the complexities of this role. I aim to remain committed to amplifying the voices of the marginalized using this platform, but I hope to empower others and foster a collective movement that goes beyond tokenism. So that means this movement focuses not on the exploitation of victims' stories, but on ensuring that their experiences and insights are included in broader discussions, actions, policies, and mainstream media. Now, before I go on to the slides, please bear with me. Survivors of sexual exploitation, particularly within the framework of gender-based violence, we possess valuable insights and knowledge regarding the methodologies employed by perpetrators of sexual violence, trafficking, and it's this understanding that is effective for interventions and preventative measures against gender-based violence. Okay, so please, let's begin. So firstly, I wanted to get to know you. I wanted to build a rapport. I want us to work together in unison. And if it's possible, I wanted to give you quite a generic overview, but there are many, this is a very complex and it's a very in-depth subject. So gender-based violence, it's not just an individual issue, it's a worldwide crisis. And every day, millions of people endure different types of harm, ranging from physical and emotional to online, sexual, and economic abuse because of their gender, gender identity, gender expression, or the perception of their gender. Now, in response to rising rates of violence against women, the definition of gender-based violence has expanded, and it also now includes violence against LGBTQI+, A+, and community and the sexual victimization of men. Now, the power disparities in relationships stem from structural inequalities based on gender norms that favor men over women, masculinity over femininity, heterosexuality over homosexuality, and cisgender identities over transgender identities. I wanted to make us aware that I didn't want to feel that I was signaling, I wanted to show that I have an understanding of the bigger picture. But despite increasing inclusivity in definitions of gender-based violence, it is uncontested that violence against women, particularly intimate partner violence and sexual violence, targets women. Now, the actions of traffickers or perpetrators of sexual violence do not solely determine the path of trafficking victims, such as myself. Extensive research illustrates that victimization often results from prolonged vulnerabilities, exacerbated by systemic under-resourcing, under-reporting, and overlooked issues spanning generations. This persistent reality underscores the ongoing challenges faced by women and girls enduring gender-based violence on a global scale. So survivors of sexual exploitation, particularly in the context of gender-based violence, offer critical insights and a nuanced understanding of the tactics used by perpetrators and traffickers. And this knowledge is essential for developing targeted interventions and preventative strategies, which is probably a whole other lecture in itself. But I wanted to talk to you about many things, and there's a lot to talk about, but well-being. And this is a complex, sort of multidimensional concept of the context in the context of gender-based violence. So when we talk about well-being, we tend to think about includes feeling good, functioning, feeling a sense of peace, joy, gratitude, broader elements such as meaning, purpose, agency, and fulfillment. But it's very different in the context of victims and survivors of gender-based violence. So selecting well-being as a conceptual focus presents many challenges, nuanced challenges. On one hand, addressing the well-being of women and girls affected by gender-based violence is emphasized as essential in global policy, but due to the well-documented detrimental psychological impact of gender-based violence, which includes elevated rates of depression, anxiety, and even suicide ideation, we have to recognize the emotional consequences of violence. Peace educators have long contended that we must grasp the effective politics of violence, referring it to as the emotional impact of the injustice to enact meaningful change. So what does that mean? I mean, there is such a considerable focus on the individual's psyche when addressing the well-being of women and girls impacted by gender-based violence, which may result in a narrow view of the social context that influences it. Currently, most well-being initiatives related to gender-based violence emphasizes on this individual psychosocial support, such as training on healthy coping strategies and self-care for survivors. Now, while this support and while these strategies are essential, I'm not undermining that. Self-care is completely essential. When we approach it, it's when we look at it in a different way. So, for example, when this approach is, we highlight the urgent need for well-being interventions and policies that aim to transform the structural and cultural factors that compromise the well-being of women and girls. And this includes controlling forms of sexism that cause survivors to be disbelieved and addressing societal stigma that contribute to their feelings of isolation. So I wanted to just address a little bit more before we go on to the slides, and I hope you're all following me. I hope I'm making sense. So what is an obstacle to well-being? Well, what do you believe society... I was asked this question, actually, that I wanted to share with you and interject a little bit. So what do you believe? I was asked, what do you believe society's mostly misunderstands about survivors' well-being, and how are we challenging that narrative? And I wanted to say that it is important to reflect on the common beliefs that what makes an ideal victim. We must challenge the prevailing ideas that create a narrow view of who a perfect victim is. So this is crucial because striving for an idealized image of victims can lead to misunderstanding that all victims are the same. Instead of appreciating and recognizing our unique experiences and our diverse backgrounds, we are not homogeneous, and as existing research findings indicate, this underscores a critical element influencing the notably low prosecution and conviction rates of sexual violence. Survivors and victims need non-discriminatory support. Research highlights a correlation between the length of support services provided to victims and the status of ongoing investigation is very different across different jurisdictions. Now, this situation leaves women and girls vulnerable to re-exploitation and exposes them to gender-based violence. So I would like to say, and really quite passionately reiterate this, that we must establish accountability, not only for the perpetrators of sexual violence, but for all various agencies involved, including those within the civil sector. There must be a structured approach to ensure accountability regarding the quality of services provided to victims and survivors and their well-being, as this is essential for fostering trust and facilitating recovery. In the private sector, it's crucial to ensure accountability to address exploitation and how it presents itself in our supply chains. We need law enforcement to be educated in victim-centered and trauma-informed practices, and governments to receive the same education. So I use my experience to empower others and challenge the narrative that fails to protect victims and survivors. And this is more than just a women's issue, because while women and girls experience higher rates of gender-based violence due to sexism and gender-based oppression, those from minority groups face further oppression arising from racism and colonialism. Members of the LGBTQI plus community, they face abuse due to their gender identity or expression, and the current global challenges include climate change, escalating geopolitical tensions, fast-paced digitalization, unstable political environments, and rising political extremism reveal that the worsening evidence of severe violence against women and girls increases during crisis as a result of their gender. And this continues to be among the most intolerable forms of gender inequality we face today. So I know I'm telling you a lot, so if it's all a bit too much, then I will take it down. But there's a lot to talk about, so I hope you're all still with me. Okay, so again, we are looking at, sorry, that's me just talking too much and not staying focused. Okay, so when we look at the alarming reality of gender-based violence, we look at some statistics, and there are so many statistics, but worldwide, 1 in 3 women has experienced sexual violence from either partners or non-partners, amounting to, I think, 736 million victims. And this highlights the pervasive nature of violence that affects various individuals around the globe. Now, according to the World Health Organization, it estimates approximately 1 in 3, that's 30% women worldwide, have faced physical and or sexual violence from an intimate partner or non-partner in their lifetime. And a considerable portion of this violence is from intimate partners. Globally, there's nearly 1/3, 27% of women aged 15 to 49 who've been in relationships report experiencing some form of physical or sexual violence from their partners. And such violence has a detrimental effects on women's physical, mental, sexual, and reproductive health, and can increase the risk of HIV infection in specific circumstances. I've just touched upon health, but I am very happy to do a whole subject talk next session on health because it's a very big topic and it's one that I'm very passionate about. So the health sector plays a vital role in delivering comprehensive care to women who have endured violence and connecting them to additional support services they may require. 2013 World Health Organization study found that women who experienced physical or sexual abuse were 1.5 times more likely to contract STIs, including HIV, compared to those who did not experience partner violence. Now, you know, I think that's just horrendous. So I wanted to give you some key terms. I can barely see those key terms. I hope that you can. So I wanted to make some differentiations on gender-based violence. So we just had a clear understanding of the differences. So gender-based violence is a broad term that describes only any harmful act intentionally inflicted against an individual based on a socially assigned gender difference between males and females. So this includes actions that causes physical, sexual, or psychological harm, as well as threats, coercion, and other forms of deprivation of freedom. The term highlights the systemic inequality between men and women, a universal issue that constitutes a fundamental aspect of various types of violence directed towards women and girls. Moreover, gender-based violence encompasses sexual violence aimed explicitly of reinforcing equitable norms of masculinity and femininity. I'm amazed that I can actually read that. So I hope that you can too. So sexual violence is any sexual act, the attempt to obtain a sexual act or other act directed against a person's sexuality using coercion or by any person, regardless of their relationship to the victim in any setting. It includes rape. It defines the physical force or otherwise coerced penetration of the, oh my goodness, I won't read that out. So intimate partner violence involves actions by a current, a former partner that inflicts physical, sexual, or psychological harm, such as aggression, coercion, abuse, and controlling behaviors. Now, I just wanted to make the distinctions so that we know the distinctions. A lot of the research and a lot of the papers do draw upon these distinctions. And sometimes when we're talking, we can use them interchangeably, but actually it's quite important to be quite clear on the definitions and their meanings. So I wanted to go on and to give a little bit of an overview of the global problem. And I wanted to look at a population level surveys relying on accounts from survivors yield the most dependable estimates regarding on the prevalence of intimate partner violence and sexual violence. And we can look at the World Health Organization in their analysis in 2018, and they conducted some data, and they examined the prevalence from 2000 to 2018 across 161 countries and territories. And it was found that approximately 30% of women globally have experienced physical or sexual violence from an intimate partner, non-partner, sexual violence, or both. So you can read what the the statistics are, but I wanted to interject because I wanted to talk about very briefly here on this slide how researchers, we need to employ more trauma-informed methodologies informed by personal experiences of observing these social disparities. So we need to be firmly committed to ethical data collection practices. So research has delineated 5 core principles of trauma-informed care within their methodologies, emphasizing and establishing trust and rapport with participants over 2 months before data collection. Strategies integrated into their approach include providing skills-based volunteering opportunities, enhancing well-being through mindful body language and spatial arrangements, and instituting measures to mitigate the risk of psychological re-traumatization linked to the sensitive subject matter. Now, you might be saying, why am I telling you this? I'm telling you this because we have a lot of aggregated data and we have a lot of psychometrics used. And these are statistics. And behind these statistics, there are people that are living just these are real people with real lives. And sometimes it just doesn't capture the nuance and it doesn't capture the really lived experience. And I think I feel that we need to take more researchers, we need to implement more trauma-informed methodologies because especially with female participants and female survivors, because it's complementary to the quantitative data that is used, and statistics, as invaluable as they are, aggregated data is essential, but we do need more qualitative data. So this is an example of where we are, but we don't have enough data that really supports the lived experiences. So I think more trauma-informed methodologies would be really essential to add to this. And if anybody wants to add any questions or any thoughts on that, we can discuss that together. So when we look at risk factors for intimate and sexual violence, we can look at these risk factors expecting survivors to define their recovery paths under the concept of well-being. So if you can see that when we look at it under that construct, it ignores external factors like mental health that may exacerbate women and girls' conditions. For example, research points out that the narrative of personal responsibility and agency places the burden and recovery and healing on women who've experienced violence. If they fail, which some women might never heal, they also are held responsible for that outcome. So these are, and I can talk from my experience that, I was not educated, I was homeless, I had all these risk factors and vulnerabilities. It's impossible to have well-being and to attain your purpose and in life if you don't have education, if you have a history of childhood maltreatment, if there's underlying mental health issues, substance misuse, when we have all these kind of prevailing societal norms, and I've mentioned gender dynamics within the workforce. So when we go on to look at risk factors, because I think they're so important to address, because it does take us out of this sort of myopic view of what a legitimate victim looks like, and it takes us into the place of what we are really looking at, is we're looking at the history of violence that's experienced, difficulties in communication between partners, controlling behavior of men towards women, in sexual violence. This is going back to those definitions I gave you. We have beliefs surrounding family, honor, and sexual purity. We have ideologies of male sexual entitlement. We have inadequate legal repercussions for sexual violence. We have gender inequality and norms that tolerate violence against women and are fundamental causes of gender-based violence. So this is a significant concern for health consequences for women and girls. And it's one solution, I think, or maybe we should talk about this in the questions and answers, is we need to, when we look at these risk factors, you have to ask yourself, well, what can we actually do? Well, In my experience of working as a mentor within the criminal justice system, and my experience of advocacy, and my experience of the arduous journey of reclaiming a sense of self, being trafficked, sex trafficked as a minor into prostitution, where I stayed for a very long time, all trying to reclaim my sense of self was the most hardest thing you can ever possibly imagine. But one solution that I find that I've found in my experiences of working with people is that we have to uplift and empower people. We have to sort of facilitate and aid in their journey towards self-actualization, a purposeful existence. It could just take one person that believes in you, and you have, and we can start working together towards what the person towards that's opposite you wants. So I take a very trauma-informed approach, which means that we meet each other as equals. I'm here to help. I'm not here to judge. I don't have any preconceived ideas or notions. I'm just here to facilitate. And I think this shift in perspective nurtures deep mutual respect, creating an environment where every woman can flourish free from prejudice, bias, stigma, slander, competitiveness, all these sorts. This dual approach is reinforced by active listening, empathic communication, emphasizing resilience and self-compassion. And these methods empower women to access their inherent abilities and create an environment that encourages their overall development, enhancing their sense of purpose and fostering hope. Now, research highlights a correlation between the length of support services provided to victims and the status of ongoing investigations across different jurisdictions. So research indicates that this reflects the stark reality faced by women, especially migrant survivors, as their status as victims is also intrinsically linked to their status as migrants. So there's so much work to do. We have to raise awareness. We have to challenge the narrative that is out there. We have to bring the lived experience of myself, but with the evidence to substantiate and support in an ethical, safe way. So it's an ethical survivor inclusion that is trauma informed, that doesn't re-victimize or re-traumatize. So very briefly, I hope I'm okay for time. Yeah, very briefly, I wanted to talk a little bit about that gender neutrality. And research indicates that this is geographic, and this disciplinary gaps challenge gender neutrality, as exemplified by studies of women in Bosnia, Indonesia, and Pakistan, and South Korea. So, for example, survivors from regions outside of North America and Europe are often overlooked or neglected in the literature, even though they face the highest rates of gender-based violence in the Western settings that are in non-Western settings that are heavily concentrated. Now, this is, I just wanted to really just draw your attention to it, because there are efforts to safeguard the well-being of survivors will be ineffective if we have specific barriers in under-researched areas are not addressed, such as gender neutrality. So well-being and peace education theories often criticize their focus on Western evidence, neglecting other cultures' realities. And if we focus on trying to, and we're not saying that, men are not victims of sexual violence, or we've looked at the other predisposing dispositions and vulnerabilities, but we are trying to show that this could negatively impact women and how we help women, and it may actually increase marginalization, ostracization, and isolation, and negatively, deeply impact women's mental health if we take, this gender neutrality into consideration. But that actually is a talk for another time. It's quite a topic. I just wanted just to give you that insight, just to see what you thought. So sanctuary trauma, and this is something that I feel very passionately about, is that without sufficient resources dedicated to safeguarding, including structural and cultural elements, professionals may feel uncertain, hesitant, or indifferent when confronted with women and girls experiencing distress. So the act of denying assistance to survivors of gender-based violence can be detrimental. as it amplifies the pervasive isolation exacerbated by the accompanying of stigma of shame and guilt. Now, this phenomenon particularly results in what is referred to as sanctuary trauma, whereby survivors anticipate support from protective institutions yet encounter a stark lack of refuge. So, if we were to think about that in the context of what we're talking about, and we take, for example, if we look at women in India, they frequently face challenges in finding safety due to inadequate legislative protections and deeply rooted social cultural norms. So these include bystander indifference, social stigmatization, and a strong preference for male children, which is often intensified by caste factors. Now, these cultural and structural factors surrounding the direct violence of sex trafficking and gender-based violence further complicate the issues discussed today regarding survivors' well-being. As it's not possible to speak out and report perpetrators of sexual violence. Consequently, we diminish the status of the victim and we render her invisible, subjecting her to shame and silencing. India has a markedly low density of social workers with a mere 0.06 per 100,000 individuals. That's by the World Health Organization in 2018. And likewise, the ratio of mental health professionals is also alarmingly low, averaging below 1 per 100,000, primarily due to inadequate funding, which the World Health Organization describes as very meager. So in Mumbai, for example, female survivors of trafficking encounter significant vulnerabilities, including heightened threats of extortion and systemic abuse perpetrated by institutions, law enforcement, and government authorities. So it's very complex, and it's really there is just so much to do to raise awareness, and this is an area that I also find that we could do a topic on is peace education. So how does peace education relate to gender-based violence? Well, despite the emphasis on the importance on women's roles in peacemaking education to address gender-based violence and related forms of cultural violence, there is a need to improve understanding of strategies aimed at preventing gender-based violence by exploring culturally relevant preventative strategies, historical and ethical aspects. For instance, there are concerns that some programs focusing on men's violence prevention against violence towards women utilize overly homogenized conceptions of violence, such as physical or verbal acts, while neglecting the structural violence, which is insidious, less visible, and leads to pervasive injustices and iniquities, including limited access to education, poverty, and unequal resources like healthcare. Peace education has not fully utilized its strengths despite its significant transformative potential. And a notable reason for this is that it's not recognized the importance of the nuances of gendered violence. Additionally, it's been argued that ignoring gender hinders the necessity for gender-sensitive approaches. Being well depends on whether women's voices are amplified or silenced. Foregrounding women survivors' voices and lived experiences is crucial, given their frequent neglect and public policy exclusion from decision-making, their lack of economic support, social support, and accountability structures. A UN Women 2023, a survivor-centered approach, emphasizes a survivor-centered approach, places the human rights, needs, and desires of women and girl survivors as the central focus of service delivery. By expressing solidarity with and compassion for victims and survivors, recognizing their role as agents of change in the global fight against gender-based violence, we must incorporate this perspective and experiences in all efforts to prevent and eradicate gender-based violence. So I wanted to give you some more definitions. I can go over these very briefly. They're talking about the macro level. So survivors in educational institutions express feelings of not being validated and unsupported by social actors, institutions, and cultural groups. The macro level, this is worldwide funding for policies and interventions that offer survivors interpersonal care, structural justice, and political accountability is frequently underfunded and given low priority. So, recognizing the well being of survivors, such as depression, anxiety, social isolation, and even suicidal thoughts, in educational and societal policies and intervention has now been acknowledged as a key priority by the World Health Organization in 2019. So, what does this mean? Well, it means that we require culturally contextualized violence prevention. As survivors outside, as I've reiterated before, North America and Europe are underrepresented in research despite high rates of gender-based violence concentrated in non-Western settings. Now, the theories of well-being and peace education have been critiqued for primarily relying on Western samples, thus neglecting the realities and meaningful making processes of other cultures. For example, as what we in Bosnia, South Korea, Vietnam, and Indonesia. So again, this comes back to data. It comes back to having we just don't have enough data, and that's an area that I would probably like to expand on myself when I'm thinking of doing a qualitative study for my PhD that looks at survivors' well-being. And I wanted to share with you something that I really, and I hope you're all okay. And it feels very strange in this room, like talking to these slides, and I really hope you're all hanging in there. So I wanted to talk about, this is another subject matter we could talk about in our sessions, is forging reflexive bonds of solidarity with fellow women. And this is an author that I particularly really like. It's a landmark book actually on trauma and recovery, and it highlights that a woman survivor is already devalued. Actually, I see this quote as exemplary of my life. And it's not victimizing myself. It's just actually about the acknowledgement of living in the margins for 15 years and being invisible, and actually the powerlessness and helplessness that comes with that. So this quote is that it highlights a woman survivor is already devalued in society, leading her to discover that the most traumatic events occur outside the realm of socially validated reality. As a result, her experience becomes unspeakable. The author here points out that we must always face the inclination to discredit the victim or make her invisible. Well, I think one way. Hello. Do you want me to wrap up very quickly?
No, please carry on, Petrina. Please carry on.
So one way is unconditional positive regard. So this is a strong refuge that empowers and uplifts individuals. It shields women and girls from the overwhelming sense of shame and silencing imposed by broader systemic forces. And this is a very important area. We collectively, as a society, as a community here together, we have to work on our biases. We all have biases. We're not here to pass judgment on each other, but it's all recognizing what our biases are and how they may negatively impact our professional judgment. You know, these power disparities that exist with vulnerable people are very real, and we have to be so respectful and really have such compassion and empathy and hold a very safe space. But it has to also be a space where it's not enabling, we're not disempowering, we're empowering. And that's another subject matter that we can talk about, because if we one thing I found with my experiences is that people would say to me, they were very interested and mostly focused on my sexual exploitation, and then they would compare their lives to my life and say, well, you know, I've got nothing to worry about when I compare myself to you. It's all this kind of language of where we position ourselves. It's inadvertently others people without any intention of trying to do any harm at all. We don't realize how we position vulnerable people. We have to preempt all preconceived notions, and we come with just utter respect, and we meet each other as equals. And this is why I like mentoring so much, because the mentor-mentee relationship, those power disparities don't exist, because I come as somebody that is there to help. I come as somebody that looks at a person's life, and I try to see how I can improve that, not doing the work for them, working with them under their guidance, and looking at ways that I can help to develop skills and create feelings of autonomy, a sense of agency, a sense of control. And that's what survivors want. We want to feel in control of our lives. We want to be seen and not invisible or silenced. Yeah, because as I often say, shame is the bedrock of all psychopathology, and we really do need to look at the stigmatization of and how we can, alleviate the suffering. So I go on to talk about silencing results from an active language, where language enables some kind of expression and turns off others. And I think I've spoken about that. We need to know how we are silenced from talking about such violence to interrupt this silence. The argument is simple. The more noise we make about the issue, the more likely we are to hear something happening about it. Resisting our inclination to be silenced is therefore essential. Now, this brings me to a point that we need to debunk the myths surrounding gender-based violence, including the idea that women provoke rape through their clothing or behavior, and the false belief that rape is merely a crime of passion, which is deeply rooted in societal norms and structures of broader society. By stigmatizing and blaming victims, such myths can diminish perpetrator accountability. And in this context, many girls just simply do not report sexual violence. And this is why we see such disparities in attrition, and why we see very few people being held accountable for the crimes that they commit against the most vulnerable in our society, because they know that nobody will believe us. And this is the problem. So while women are, so yeah, there's one point I wanted to say as well. So I just wanted a little bit more about this. And you can read, I'm sure these are examples of gender neutrality in research, and gender neutrality and gender bias. So, and I just wanted to just give a little 2 minutes on this, which is, while women are disproportionately affected by violence, this does not imply that male victims should be overlooked, which necessitates attention from the state and policymakers. Consequently, pursuing a gender neutrality strategy in violence prevention and treatment initiatives has faced criticism, as some question whether prioritizing gender neutrality detracts from addressing the challenges faced by women, especially when it relates to domestic violence, prostitution, and human trafficking. So this neglects and highlights a troubling trend where the mental health and marginalized groups are often overlooked and therefore underfunded. So I wanted just to draw that to your attention. I think this is my last slide, and this can be, I think the slides are given to you. It's a theoretical framework. It's quite interesting of what I was talking about before, about the macro system, mesosystem, ecosystem, macro system. It's all quite theoretical, but it's quite interesting how they all interrelate and are connected. And I think that's it. I think I will just have a concluding. No, I think I've said everything that I could need to say. And I think I'm going to finish there, because I think I've spoken for long enough. Thank you very much.
Thank you very much, Petrina. Thank you to all the was online. Before I will open the microphone, there is one question there so that you will not be lost, Petrina. It's Maria who want to know that the statistics shared on the previous slide are the updates or the old numerical data that you shared?
Which statistics are those? Yeah, yes, but I think there's still, I could probably find there's still quite, thank you for bringing that to my attention. But I think they're still representative of the problem. But if you, yeah, of course, I would take that on board. Maybe you would like really up-to-date statistics. That's fine, no problem. So is that answering the question? I don't know which one.
Yes, I think yes. Okay, for Alyssa, we'll just say that let me share document. She will say that what measure are in the place to protect vulnerable children for sexual abuse, and how can we ensure that these measures are effectively implemented and enforced? By Toby Rosine. Oh,
Thank you.
no, I don't. This is Ali. This is Ali question. Sorry, Ali. Yeah.
So what measures can we implement for protecting children? I don't actually work with children, so that would be a subject area that I wouldn't be able to advise correctly on that. Maybe there are more people here online that are experts in that area, but I don't work specifically with children yet. I work with adults, so I wouldn't want to give information that I wouldn't have access to. I'd have, so sorry.
Okay. So there are so many questions. Let's start from up. I think that there are some.
Yeah.
Are you okay, Petrina? What we also do is that to not really waste time on read. Those who are okay, we have those who have raised hand, and what we will do is that I will give two people that raise hand the words, and I will read two questions. So we will be equal because the time is running, and then we need to be really effective. So we will start with Barisha. After Barisha, we will have Wali, and then we have Ambea. So Barisha, can you start the question, please?
Yeah, first of all, hello everyone. My name is Petrina, and I need to thank Mas for the beneficial information that given. But there is a question struggling into my mind that in today's world, most of the people are just focusing and over focusing on women, on feminism, on the rights of women, have they been wasted and they've been revealed as a part of society whose power is less than men. Although we have like some societies in which the matriarchy is available where men are not being given their rights, some small societies, but this overfocus is always like curious, making me curious. Does this shows that women are really like not having enough power to compare themselves with male? That's why that the world itself is just putting a special focus on women, or this is just a belief that had been approved on human beings from the past generations, and that's why we're trying to make everyone change their opinion on this concept. Could you please give me some information about this?
Okay, so thank you very much for your question. And so I'm following and I'm answering it correctly. You're looking at the power disparities that exist between women and men and why we are still dominated by the patriarchy. Is that right? Is that what you're trying to suggest? Why there's still so much focus on this, and just trying to understand what you're specifically asking me to elaborate on. Is that correct? So we're clear with it. Is that right?
You're correct up to a point. My question is that why there has been over focus given on female, on their rights. Does this shows that they're not having enough power to save their rights? That's why the world, a bigger society, is needed to protect them, or we just want to change a perspective, an old perspective?
Yes, that's right. And that's beautifully put. And thank you for raising that point. You're absolutely right. But I think it's important to understand that as a survivor, and what we're trying to do here with the impacts of gender-based violence on well-being is that we are trying to open up pathways of where we're looking at the evidence, and there is evidence, there's so much evidence to support that these power disparities exist, and women are inherently more vulnerable just because of their gender. And when you put all these other risk factors and predisposing vulnerabilities, we're looking for equality here. So it's not about, it's absolutely what you're saying, and I totally agree with what you're saying, but it's about recognizing that we are so far away from achieving equality in this, particularly in my lifetime, and I think probably for most of our lifetimes. So it's about a fight to raise awareness. It's about a battle to want to have that equality for all women, to open up for women, especially of marginalization, of where there are opportunities that are presented to them, so that they can they're empowered to reclaim their agency. But we can't do that without addressing the broader societal context that significantly affects such agency. And we can argue it is about addressing those disparities, and it's about challenging them, and it's about trying to come in and alter people's perception and alter their beliefs. Because I'm certainly not an expert, but I have a long history of knowing what it's like to live on the other side. And in my work and my work experience, I know that it's all about raising awareness. So yeah, thank you. Thank you for that point. And does that answer your question, or would you like to? It's a debate that you and I could have. We could sit here, have a conversation about this. And
You're right. That's something deep, and really need to talk about it a lot. But there we have a time limit, unfortunately. Your answer was satisfying me, but still, for example, you see that in the United States, all the rights have been given to the ladies. They can work, they can study, they can educate, and they can do whatever they want and whenever they like want and have the desire to do it. But still, we see the existence of feminists there who are fighting for their rights. What do they fight for? What do we want to achieve? What's the total and general aim feminists have? And what is the thing that all we ladies, need to achieve in this world? Could you please specify that specific thing?
one, I'm not a feminist. I don't take, I passionately believe. So I'm trying to be, but you see, respectfully, I agree with everything that you're saying, and you're right. But when we come to this subject matter and we intellectualize it, we can kind of lose the essence and the nuance of what we're trying to communicate here. So everything you're saying is spot on. And I can't answer for those huge movements. We know that these statistics exist. We know, we can see, we've looked at the dire situation that women are in, and we know that it's unequal. But I guess for me, it comes back to the simple message of we have to raise awareness. We have to keep talking about it. We have to keep discussing it. We have to make sure that women and survivors are not silenced. We have to amplify our voices. Maybe we have to ask feminist movements why they feel, so passionately. I don't believe it's about then attacking men. I don't believe in that at all. I believe in, it's about a unison, it's about working together. Men are equally as victims of so many heinous things themselves. So I don't, for me, my approach is never about signaling one area off and focusing on another. It's how we can collectively come together in solidarity and raise awareness and create more opportunities and more preventative and intervention strategies for survivors and victims, and create more inequality. I certainly cannot do that. I can stand here with remarkable people like yourself, and together we can discuss all of these things. And that's how we raise awareness, and that's how we grow. So I hope that makes sense. I know that's not what you wanted to hear, but it's as much as it's what I feel, and it's how I would challenge your question. Does that make sense? Are you happy with that?
Yeah, thanks. That was satisfiable. Thank you so much.
Thank you so much.
Now I can search more on it. Thank you.
Always feel free to email me and we can have a talk. I'm always open to a debate.
May I
Thank
have
you. Thank
ID?
you. Thank you, everyone. Thank you. No worry. We will share once again Petrina link of link and link. So you can continue discussion with her directly. No worries about that. And I will invite people to be brief on their question to allow other people to ask their own also, so that we can give the chance to more of them to ask questions to Petrina. I know that the topic is really interesting, but we have on another times to talk about it more and more. Okay, so Petrina, to continue, I will also first, before I give Wally the mic, we have Main Hamjad thinking. She said, "Dear Petrina, we will appreciate guidance on how to identify early signs of being targeted and how to observe warning signs in other female in order to help prevent or avoid such situation." This is the suggestion of Dr. Mahim. Okay, Wally, before I read the next question, the mic is yours. Please be brief to your question.
Is this for me to answer? Yes.
Hello, thank you for your wonderful presentation, and this was great. So I have one questions. That's sometime I'm working in Afghanistan since 2012, and I have implemented the most of the GBV projects. And currently, we have also implementing, but the current government is do not like the GBV words. Actually, once we are defining MOUs, these things. So we are trying to integrate some activities with other activities, the GB activities with the other activity, but they may be identified by the local governments, and this will be affected other project activity as well. So how we can identify, is it violence against other humans or
Yeah.
not? Because if we are integrating the GBV activity in other activities, it will be maybe 75% activity. Other activity will be maybe affected by the GBV words. So how you suggest that's how we can integrate these GBV words with other activities that should not affect other activities? This is my first question, and second question was what is gender equality and equity, and how we can ensure in our workplace. This is the two questions from it's referred to you, and also one question is some question or some things like I'm not wrong about her name. So, as I mentioned, I'm working since 2012 in humanitarian sectors and finance. So, I have already shared my CV and also my backgrounds with your team. So, I'm also once I'm following these trainings. So, I'm trying to be volunteer with your team to provide some trainings in financial management and humanitarian sectors. So, if there is any scope to be given an opportunity to me to sometime I provide trainings to other colleagues as well. Thank you. Close to you.
No. Thank you very much. I'm just going to, I've written some of this down. So I'm going to address gender, the definition of gender equality, or what I see it and perceive it as. So I think it's a state where there are, what is gender inequality? So first of all, I'd say it's a state where there are unequal distributions of rights, resources, and opportunities based on gender. And this means that individuals are not treated equally based on their gender. So And this could arise from factors such as discrimination, sexism, unequal access to education, healthcare, employment, and political participation. I understand that my presentation was quite in-depth and it evokes a lot of questions. But I think there are things that I would say. So we were to break that down a little bit. We'd talk about the unequal access. So I'd give one example of that. We'd say that at least the disparities in education, and and stereotypes and discrimination. So I've written down here that cultural norms and societal expectations can contribute to gender inequality. And this is an area that I did my own research in for my master's, and about stereotypes and discriminatory attitudes towards individuals based on their gender. We can look at power imbalances when we look at inequality. So because we're seen as a power imbalance between men and women, where one gender holds more power and influence over the other, which is what the last lovely lady was talking about. And also an area that I haven't discussed here today, which is part of the is intersectionality. So gender inequality is often intertwined with other forms of inequalities, such as ethnicity, sexual orientation, race, disability, and also lastly the impact on society. It has a broader societal consequences for our economic growth, social stability, and what I try to put across today, looking at well-being. How do we, your first question, how do we identify the language that we use for gender-based violence? Yes, I absolutely agree. I would never, that is a subject matter that we could do, what I'm happy to do a session on, and we can work collaboratively together. I don't want you to see me as an expert. I'm not. I'm here as a survivor. I'm here as somebody that's educated myself to become a psychologist that works in the criminal justice system. So the language that I use here to talk to you today will be very different to the language that I would ever use if I was working with somebody and mentoring. And you're absolutely right to draw attention to that. I actually don't know what that is and how we would refer to gender-based violence and how we're meant to infer to gender-based violence. But I guess you may know more about that than I do, but it's something that I've made a note of. But language is very powerful, and thank you for bringing that to my attention. And I agree with you, but maybe you can answer that for me. Maybe you know more than I do, but I certainly think how we position people in the relationship, which I used about the unconditional positive regard, where we mostly actively listen, we build a rapport, where our communication is premised on the respect and the dignity and the rights of the person that we're working with. Very often we are not enabling, we are facilitating, and therefore any language that we use would be premised on being non-discriminatory and trauma-informed. And yeah, and does that make sense? And potentially that would not re-victimize or re-traumatize people, and language has the potential and the power to do that. So does that help?
Yes, thank you. The Women Ascension will share your LinkedIn, so we will be in touch. So if I have any questions, so I will directly reach to you. Thank you.
Yeah,
And one question.
Thank you very much.
I'm Jade. My one question is remain to you with you.
Yes, Wali.
Thank you.
Let's continue with Miss Petrina, and I will contact you on WhatsApp. Would that be good, Wali?
Yeah, thank you.
Perfect, Wali.
Thank you. Thank you very much. Thank you. Before we give the microphone to the next person who will raise a hand, I want to share with you the next question, Petrina, from Florence Dubé. She asks, how can we really stop all type of violence? Because we'll talk about them, teaching about them, but there is no improvement. Instead, they multiply.
So could you just repeat how can we stop violence?
How can we really stop all types of violences? Because we talk about them, we're teaching about them, but there is no improvement. treatment instead?
So, from my understanding, violence prevention or eradicating violence ultimately is the goal, but we have to practice, I think, in my opinion, situational awareness. So as the last person brought you to the attention, we have to manage our language, we have to acknowledge problems, we have to be empathic listeners, and we have to use silence. We have to not silence ourselves, I would think. It's a huge subject. I mean, and there are only skills and skill sets that we can utilize and use. So if we are we can implement, that's why we need policies, where we need educational programs, why we need early interventions, strategies, preventative strategies are huge, why we need to address workplace violence, why we have to issues like I've written here, poverty, inequality, gender inequality. We have to promote education, we have to foster life skills, we have that significantly reduces violence. And again, it's about situational awareness and safety. So we have to have personal safety. We have to, it's so broad. We get, there's communication, using clear and calm language, avoiding raising our voice, conflict resolution. So yeah, it's we need to address the root causes. And I think for me, from my own lived experience, what I draw upon the most is that we need to invest in education, and we need to foster in young people and help them to develop healthy coping mechanisms and resolution skills. So yeah, I hope that answers a little bit. It's a very, we could talk about this, and we could look at areas that you feel quite passionate about and I do, and we could come together. But I think addressing gender inequality involves challenging beliefs on masculinity, and we need funding for women's organizations. We need ensuring equal access to resources. So all of these things will help and facilitate the end goal of eradicating gender-based violence and sex trafficking. Does that make sense? And also coming away from this idolized legitimate victim, understanding that we're not homogenous, we are heterogenesis, we're diverse, we're different, and we have to challenge that narrative of what validates and legitimizes a victim, because victims, and that's a whole topic in itself, but that's also very powerful. How can we get people to recognize when we have somebody before us that is a victim, when the person themselves may not even be aware that they are a victim? And that's again opening up another conversation. Does that help?
I think Florence Dubé is satisfied. I think she's satisfied. So we also give Ambea. Ambea, if you are online, the mic is yours. You can ask your question.
Good evening, all. Good evening, Petrina. Good evening, Pascaline. Thank you for the binary. It's very impactful. So, first of all, I wish to start by just highlighting the importance of taking into consideration the boys and the men into this fight against gender-based violence, because we always fight against gender-based violence, but what are the causes? I think the cause we should think about the education and empowerment of men and boys, because if, for example, when we take the example of Cameroon, we see that violence increases in communities and also drugs increases. And if we take the physical difference between the woman and the man, we see that when a man engages into substance, he becomes more violent, and of course, the woman becomes more exposed to that. So focusing only on women and gays can be one of the weak points to really address this problem, because men and boys are the ones that are, let me say, the beginning of the problem. And if we think about doing something into that way, it can help to reduce violence and to make the world to be a better place. So my question to Petrina, as a GBV survivor, what can you say? What can you say to this girl or this woman here in Cameroon that went through the same pattern, maybe not the same, but that went through that same experience, considering the fact that there's a cultural diversity? What can you say? Because at times it's difficult to have the right words if you are not been into that situation. Thank you. Over.
Okay, thank you very much for your question, and thank you for sharing such vulnerable information. Okay, so wow. Is it my understanding that you're talking about challenging toxic masculinity in the context of your culture in Cameroon? I can only say that we have got traditional expectations around male behavior, such as dominance, emotional suppression, and aggression. So violence and discrimination against what I've written here against women and girls. So men and boys do play a key role because we're trying to reject the stereotypes and promote healthier, more respectful expressions of masculinity. And it's not just a woman's issue, and men and boys, I do agree with you, play a crucial role in ending it by challenging harmful stereotypes and promoting equality. Men and boys can be powerful allies in preventing gender-based violence, and by engaging men and boys, we can challenge the harmful norms and the behaviors that contribute to violence and discrimination. I think this is my viewpoint, and I would look, it's a conversation again that we have to have together, and I wouldn't want to infringe upon your knowledge and and your expertise and your understanding of this. But for me, coming from a woman that's got lived experience, who's suffered at the abuse of men for a long time, for 15 years, I would argue that it's about I would argue about educating peers and maybe communities, supporting survivors and respecting their boundaries. So if we explored a little bit on the first topic, I would say, I wrote down that by speaking out against violence and challenging sexism, we can help shift attitudes and prevent harmful behaviors that escalate. There are campaigns, I know there are campaigns that participate in raising awareness and discussions. I'm actually, working with I'm actually working soon in Cameroon in September with a wonderful NGO, and I'm actually educating and lecturing on gender-based violence and some substance misuse. So I think it's all about actively participating in campaigns, discussion, educational initiatives to spread awareness about gender-based violence. I'm aware of your knowledge on it, so I think I wouldn't want to say too much more than that, except that men can step in, and when they witness harmful behavior, they can encourage people to speak out, perhaps, and show solidarity with those affected by gender-based violence. That's I think it requires a collective effort for what I talked about before, and solidarity. And I think men and boys have a very important role to play in that. And I think we need to challenge these harmful norms, educating others and having positive role models. And these will all create a more safer and more equitable world for all. I know that it's not answering your question, but I think it's kind of addressing it, and we could go deeper into it in different aspects. But that's probably as much as the scope of what I could say. How do you feel about that?
I think
Thank you.
Mr. M Okay. Okay, I think that you satisfied the question is
Yeah,
the
thank you. Thank
clarification
you.
is good.
As,
You're welcome.
You're so
You're
yeah,
welcome.
welcome.
okay. As Patricia said, it is a broad topic, and I think we need to walk into it to develop strategies how we can address it. Thank you.
Yes, and I'm very happy to have a session on how we can develop strategies. You know, I really want to emphasize that we are here working together collaboratively in solidarity. I certainly don't. There are people that are on this call that are far more expertise in these areas than I am, and it's about just learning from each other, but always being mindful that that I come from the place of lived experience and that I've educated myself to have a voice that is credible, that is premised in evidence-based and is speaking of the reality of gender-based violence. But obviously, there are so many areas and topics that we can talk about, and it's good to know. I've noted down all of this, so it's good to know the depth that we need to go to and have very up-to-date statistics for everybody. And it's good for me to learn. We're here to raise awareness, and these questions are very important questions.
Thank you very much, Petrina. I know that this topic is very huge and really, really nice. And I think that maybe when Ascension, we'll think about how we could make another session. And we will probably take one topic on gender-based violence, because gender-based violence is a really large topic. So the next question is from Jitewo Clara. Okay, she asks, what are some of the international policies put in place to target issues on sexual violence?
So international policies on
Gender-based
gender-based. Okay, hang on. And gender-based violence in general.
She has not specified, I think, yes.
So, well, they mostly aim to prevent and address violence against women and girls, and they recognize it as a human rights violation, and they ensure accountability for perpetrators. So, if I think about the UN resolutions and the UN Declaration on the elimination of violence against women, and I think key international policies and instruments, well, again, I would draw on the UN resolutions. The UN General Assembly and the Human Rights Council have adopted resolutions addressing violence against women, and they focus on eliminating all forms of violence, combating trafficking, and ending specifically, I think that's the one that I would draw upon the most, the UN Declaration on the Elimination of Violence on Women, 1993. But there are many policies, and I think these policies also address the root causes of violence, and such as gender equality and harmful social norms. And there are key international policies and instruments. I know that one is the Istanbul Convention, but offhand I wouldn't be able to give that off. But does that help? Do you know of any yourself? Is that why you're asking? Is it because you'd like me to send you and research it further? Does that help?
I think it helps. She's online. She just to
Add
write
one
if she's about.
little point to that. I think because I think I've mentioned it in our talk, but I think it's all about protection, prosecution. I think prevention, protection, and prosecution. So these are what I have been taught and what I have learned. So for example, implementing policies and programs to prevent violence before it occurs, including addressing, as I've talked about, gender inequality, gender education, addressing harmful societal norms. So we challenge those norms, protection, ensuring we have access to support services, and safe housing for survivors of violence. Then we have prosecution, which is an area that I've researched extensively on, which I can talk about if you'd like to do a session on. It's criminalizing violence against women and prosecuting perpetrators. And data collection and research, which I think we talked a little bit about here today, gathering data on the prevalence and the impact of violence against women to inform policies and programs, and increasing funding for services, all these, and addressing conflict-related sexual violence, so measures to prevent and respond to sexual violence and conflict situations, ensuring accountability for perpetrators. So, does that help?
Yeah, she said that it's helped. She said yes. She said yes. Thank you. We have like 9 minutes remain, so we will use that 9 minutes. This is the next question for you, Petrina, from Amma. But I think that you have already addressed that question, because I have already answered that question because it is similar. She asks, with all the awareness raised about gender-based violence, why does the rate of gender-based violence continue to increase? I think I think it's similar with the Dube question, but if you want to answer, please do.
Well, I think I would answer it from my own lived experience. Raising awareness is beneficial, but it doesn't always guarantee an increase in knowledge or behavior change. So, for example, awareness campaigns can be effective and they can simply increase knowledge, but they often fall short when the goal is to drive action or influence attitudes. So, why is that? Well, I think it's because we just have what we're talking about, factors like knowledge alone doesn't always translate into changed behavior. And that is probably one of the biggest stumbling blocks that we have. The prejudices and biases that we have are ingrained in our societal norms, in our own individual beliefs, within our communities, they're in our institutions, they're in our policies. It's about, we have to believe survivors. We have to believe survivors and victims of gender-based violence. And it's only then when we can educate people of how to recognize victims that we will see that there will be a change in behavior. We have to understand awareness as a foundation. We have to, so how can I say about that? So we have to use knowledge as a bridge. We aren't going to find that we're going to have all of these, nothing is going to everything is going to be incremental here. The more we talk about it, the more we have this dialogue, the more we're respectful, the more that we honor each other's viewpoints. And we collectively are building a narrative that is altering and changing implicitly and explicitly our beliefs. So when we look at trying to come away from the aspects of intellectualizing this and coming from it from a place of not being dehumanized or desensitized to the suffering of others and seeing us all as sentient beings, when we bring the humanization aspect into this, when we look at things that I talked about, reflexive bonds, where we look and reflect on our own selves, when we know that we are sitting in the presence of somebody vulnerable, that we preempt, and it's just all about working on our own individual selves, working societally and working within our communities, within our governments, within the private sector, within the civil sector. Everybody has a price to pay. Everybody has a role to play in this. We are not alone in this. And I think the goal of many awareness campaigns is to drive action change. But this we have to look at the potential barriers, which is what we're talking about here. We have to look at these potential barriers. And I think for me, what I'm going to do with this talk is I'm going to sort of find a way of amalgamating the two of what I know to be my own lived experience, because we all have so many different experiences that we can bring to this. So we have to look at things that I probably will talk about a lot, and is individual circumstances, social norms, and our personal beliefs. So how do we believe survivors? You know, when they don't present as the way that society portrays them, when we are very different, when we have advertisements and campaigns that focus on, you know, images portraying women in a way that does not representative of the actual lived reality of women who are experiencing gender-based violence in all of its many different guises. So I think it's important to address many social and health issues, but it's not a one-size-fits-all solution. We need to, yeah, it's a combined effort, and it's working in solidarity, it's working with compassion, it's working with respect, it's tirelessly working, actually. It's a lifetime's work. So yeah. Does that, and I think I did say actually that in a question that I was asked that what would be my legacy, because I just did an article for a magazine that asked me what my legacy would be, and I think that's a really good question, and I think it's just, you know, we have to just believe that change is possible, and we have to fight, and my legacy will be doing everything that I can within my power, within my remit, to, you know, exercise that change. You know, I can't gain back the time that was taken from me. Yeah, I can't gain, because I present to you like this, you probably wouldn't have spoken to me 20 years ago. Yeah, I can't gain back things that we all take so much for granted. And I think it's about tirelessly working at preventative measures and all the different ways of helping to prevent and help young people as well as older people, not distinguishing between anybody. But let's just try and do as much as we can to stop it from turning into generations and decades and years of this terrible impact of gender-based violence that it has on our communities, societies globally, and ultimately on women's well-being, which I've only just touched upon here. That in itself is a very intense subject. Does that help?
Yeah, thank you. I think that it's helped. Okay. I think it helped. Like we have like 2 minutes remain. For those who have questions now, there's this one question again. I think I don't know if Women Essentials allow us to have like 5 minutes more, so we can address these 2 last questions, then we close. So yeah, thank you very much, Women Ascension. So I have this question from Ota Margaret. She asked, what knowledge and attitude about gender-based violence are important for professionals working in development and humanitarian settings?
Sorry, could you say that again? What knowledge and
what knowledge and attitudes about gender-based violence are important for professionals working in development and humanitarian settings?
Wow. It's humanitarian settings. Well, gosh, I think I'd have to draw on my own experience again, or maybe that's a really good question. Really good question, and it's another one. Okay, so where would I say? So I would say I have to think about that one actually. Is this sorry, I forgot this young lady's name. Is this somebody that's working in humanitarian conflict settings?
Yeah, she said it's Ota. I don't know if Ota can take the microphone. She more clarify her question.
Yes, great.
Ota Margaret. Please, Ota Margaret, can you jump in the mic and clarify your question to allow Petrina to give you a good answer, please? I don't know if she's still online. So
Hello.
Hey.
Yes, welcome. Okay, we hear
Thank
you. Okay,
you.
let's go.
You're so welcome.
Thank you. Thank you so much. Thank you for the insightful session. So actually, we in Cameroon, we are presently in the development stage and also doing some humanitarian work. And over the years, we are in a crisis affected area actually. So over the years, we have been sensitizing on gender-based violence for a very long time, and we keep on sensitizing. So there is still a lot to be done. And now we are trying to shift into development. So I just wanted to find out, like, what are the when it concerns gender-based violence, the knowledge that those who are working in humanitarian and developmental world presently, especially in Cameroon, in crisis-affected area, what are those knowledge that they need to really like look onto why they are going back to the field to do a lot of work, to do a lot of support to survivors
So
that can
thank you.
really create a change?
So, right. Thank you very much for your question. Thank you. And thank you for sharing. So you're asking me what skill sets that you could use to already add to all, by the sounds of it, your remarkable skill set, and I commend you on the work that you're doing. What do you think, how you can enhance your interaction with survivors and victims? Is that what you're saying? From what I can understand, I'm trying to understand the question actually, because there's a few different ways that I could answer that. So I could answer it from my own lived experience, which I think is probably the safest option to do, because I know from my very limited understanding that there's a lot of this is trafficking is exacerbated during and after conflict, owing to the breakdown of the political, economic, and social structures and the high levels of violence. So I think it's just about what we discussed before, and I hope I'm not doing you a disservice by saying that, but I think it's all about, yeah, could you just abbreviate? Because I've spoken so much, I don't want to just keep saying the same things. I'm just trying to understand. I'm very sorry. Could you just break that down for me, just very concisely, what you're trying to ask me? Is it you're asking me from my own experiences of what it's like to be a survivor and lived experience of what I would want from a humanitarian, from an organization, or do you want me to draw upon my experiences on my studies and all my work? Would you mind just elaborating a little bit on that?
Uta, please, can you open your mic to clarify?
I mean, yeah. I think, I could, if we want to take away some key points and key messages, key words that I put down here, yeah, I think it's all about just reiterating what I said, which is there are key messages on gender-based violence, but what is the message actually, the overall message? And I think it just is, we just need to be, I don't know, it's about reiterating the same thing. I'm sorry, I can't answer it because I don't understand. I wouldn't want to be doing you a disservice.
I
And
think, Petrina, let me see
how
if I
about
can
you write me
help
the
you.
question, and write to me on LinkedIn. I will answer it that way. Does that
I think,
because it's such an important question, and I wouldn't want to misconstrue or not validate or potentially say something that could potentially be upsetting. So I would rather, when I'm unsure, I'd rather not say. I'd rather ask me the question and then I can look at it and then I can answer. I wouldn't want to give you any information that you potentially think that's not true or it's misleading.
Okay.
Does
Ambea, I want to say something. Let's open Ambea, if you want to open your mic and say.
Yeah. Hello.
Hey.
Yeah, we're
Hello.
getting you.
Hi.
Please, I just want to jump into help Petrina about the question that was just asked. And I think it's mostly focusing on skills, especially as far as we're in a crisis zone. How can what skill professional can develop to give, to offer better services to people that face gender-based violence? I think that we are doing it by having this kind of session, having this educative interactions. And also in Cameroon, I know there are many NGOs that are continuously having webinary and session of refresher course, and especially as far as gender-based violence is concerned. And there's also UNFPA that is doing a very great job with other NGOs to capacitate and empower various actors so that the quality of services that they render to GBV survivor should be upstanding. So thank you. I think that's
Thank you very much, Ambea. And I think that I saw in the chat box a member of one of UNFPA in this session, but I don't know if you can say something before we close, because I know that UNFPA is really one of international organizations who's really focused on gender-based violence in the world. I don't know. I think that is there. If it can say something, he can raise hand, and we will be happy to hear from him. Okay, Elizabeth, yes, you can open your mic. Thank you. Yes, Elizabeth, you can go ahead.
I think please, sorry for jumping in. It's Gordon. It's Gordon, the focal point. Take Gordon.
Oh, okay, Gordon. Okay, go ahead, Gordon.
Good afternoon once more, and thanks a lot for the presentation. I've been trying to follow despite network challenges. Petrina, congratulations for your session. You're quite audible, and we learned so much. Mitch also learned so many things. I'm Gordon. I'm from UNFPA, the United Nations Sexual Reproductive Health Agency, and the Global Lead for Gender-Based Violence Area of Responsibility. We in Cameroon, we are with respect to the question that was asked, that Cedric was given some elements. One of the key skills that we know everybody needs to develop or has or possess when you are working in humanitarian settings is deals with a lot of psychosocial support skills that you need to know, communication skills, and particularly attending behavior and how to get people feel very comfortable, especially using the survival-centered approach. That is very important and key when working with GBV survivors. But one important thing we need to know is the aspect of gender-based violence case management, which is there's some organizations that offer these trainings in Cameroon, I think also in different parts of the world. But it's very important to master gender-based violence, GBV case management, because when you follow the different steps, the 6 steps of GBV case management, you'll be able to accompany a survivor, attend to her, and probably do the different types of informed referrals so that they can make informed choices on how they can regain maybe their stability emotionally and also become more independent. So there are just so many little things. Yeah, also in Cameroon, when it comes to coordination, we share a lot of online links for trainings for organizations and GBV practitioners to continue permanently develop their skills. Is very important. There's so many online courses on gender-based violence, gender-based case management, psychosocial support, mental health assistance to gender-based violence survivors. I mean, as you are intervening, you are working with these survivors. When you go to the field, you discover that there's some knowledge gaps that you have, and you can rely on these online trainings. And when you come now to this type of exchange that we have with Petrina, you can now ask some type of questions for clarifications, better orientations, also exchange with colleagues, especially when we have the opportunity to have on-site trainings. So there are a series of links that we generally share from UNFPA, from UN Women, from IRC, and many other organizations that deal with gender-based violence. So there are trainings online. People need to try to follow them to beef up their skills and see how they can continue to provide quality support to any GBV survivor. So that's just it. I think that's it. Thank you.
No, thank you very much. Thank you. And I really respectfully thank you. And I commend you for the work that you're doing. And you know, there's so many areas to develop so many different skill sets, especially in psychosocial case management, as you were saying. And I think as I agree with you, there needs to be like individual need skills in assessment, if that makes sense, referral and emotional support, which is something that I don't think I have talked enough about today, but I think your expertise has really sort of consolidated a lot of what I've just tried to say. You summarized it for me, so thank you. But I think the skills that we're talking about and what you're suggesting, and I'm open to doing as much training as possible, because I always think it's so important to be so knowledgeable about these things. But I think we need to allow us to identify gender-based violence and victims and survivors. We need to assess their needs. And I think this is where I come from my own lived experience with the amalgamation of my studies. The studies are just to give me the credibility to be heard, really. I think it's connecting people with the appropriate services that you suggested and supporting recovery. And I think I'm particularly very interested in psychosocial, identifying the assessment, referral, emotional support, and safety planning. I think developing safety plans to protect survivors from further harm is something that, you know, we could have talked about further as well. But I think it's a multi-sector need. So it's like health, mental health, legal, safety, all these things that you talked about. There is so much to do. And what I love about Women Ascension is the solidarity that we have here as a community, how we can all help one another and do this remarkable work that we're trying to do of impacting and change. So yeah, I hope that makes sense. I think something that we didn't, perhaps what I wanted to talk a little bit about, which I know we haven't got time, is the confidentiality and trust, but trauma-informed care. This is an area that I feel would be really useful to do a session on, because it provides support that is sensitive to trauma survivors and their experiencing, and it avoids re-traumatization and re-victimization. It also stops vicarious re-traumatization. You know, this is huge, actually. You know, and how we can have self-care strategies with that, and how we can look at developing trauma-informed care and cultural sensitivity as well, understanding the cultural context of survivors and tailoring support accordingly. So much to talk about, but I'd be very interested in some of those links. So yeah, right. Yeah, that's it really. But thank you so much. Thank you.
Thank you very much, Petrina. We have a last intervention from Christy. Christy, open your mic. Hello, Christy. Are you there? Oh,
sorry, the network problem. I didn't get you. Sorry. Thanks for the opportunity and a beautiful presentation. I just wanted to add to what Gordon highlighted when it comes to the skill that you're supposed to acquire when dealing with GBV survivors. I just wanted to add the active listening skills that you have to. We know that you have to be empathetic, and then we also have trauma-informed care. You should be able to understand the sensitivity of the survivor's need. You also have to be cultural sensitive, ensure that you're understanding the cultures and the complexity of GBV in the different contexts where you find yourself. And also, he also talked about case management, GBV case management, which is, I think that has been done and emphasized in Cameroon, where trainings have been conducted with different organizations, especially UNFPA, who have done a lot to ensure that they build the capacity of organizations, especially case managers and psychologists and other service providers, even the community, to be able to provide first psychological first aid, because most of the times those are people who have, they are like the entry point of GBV survivors, and then going totally to the case management process, which is mostly handled by case managers and the different organizations. I think a lot of capacities have been built on that. But the challenges sometimes is the limited resources that are available at our disposals, given that GBV survivors, the situations and the experiences are not the same. So there are different needs. Sometimes we face challenges trying to provide, having those resources to provide and meet up with these different needs. So maybe after this, we may try to discuss further to understand, because I'll also want to use this opportunities maybe to understand, to do a comparative study with probably the service provision that we do in Cameroon and that which is done in other countries. What can we learn, given the fact that we all face issues of limited resources? That is the little contribution I wanted to add.
It's a wonderful contribution. Thank you so much for your incredible knowledge, your expertise, your skills, and I commend you for the work that you're doing. And yes, I think I just wanted to draw on one thing that you said that I really, that as you hear me say this a lot, but it's an area that I'm really passionate about. It's about active listening. And when I was listening to you, active listening is trauma informed. It's that focus on paying attention, understanding, and responding thoughtfully to the person that's in front of you. And I think this includes being also just mindful of body language, our tone, how we speak, facial expression, very big with survivors of gender-based violence. And I'm drawing from my own experiences here, my own lived experiences. Is respecting the other person's space and boundaries and validating feelings and emotions. So I think I really like the one of the key skills that you talked about and very kindly brought to our attention is listening to trauma-informed care. So I think just giving somebody your undivided attention is so therapeutic. Building that rapport, having that therapeutic alliance where you trust somebody is just it's so important. It makes making that effort to really try to understand, being, as I said, respectful of body language, that's really important. Maintaining eye contact, use open and engaging and posture. Let's not cross our arms or cross our legs. I mean, survivors are we're instinctive, we're intuitive, we're so perceptive and astute to our environment and to others. It's a survival mechanism, empathy that you said, validation, open-ended questions is another thing that I made a note of, questions that encourage us to speak, to elaborate, so that we can ensure understanding. One of the slides that I touched upon a little bit today, which I hope we grasp the message of, was reflective listening. Paraphrase or summarize what's being said. If you don't, for me, I will never do anything that if I don't understand, I will say I don't understand, and and again, non-judgmental approach. Now, I use that a lot, and because it's very difficult when we are interpreting, criticizing, or judging somebody. Maybe I don't conform to what you all think a victim should look like. Maybe I don't sound or appear the way that you think I should appear. It's really coming with that, respect and respect of that, not, so I think as well, facing boundaries. We haven't talked about that, respecting about allowing them to share information at their own pace. It's of course we have them within the confines of confidentiality and debriefing and all the other areas, but it really is a skill set. Trauma informed is, prioritizing self-care, as I said, collaboration, it's self-awareness. Be mindful of our own emotional responses and reactions in when we work with survivors and vicarious re-traumatization. I tend to be somebody that always asks permission if I can write, or if I want to. Sometimes I like to make notes. As you can see, I have notes everywhere. I suffer from anxiety. I'm incredibly fine now, but it's just something that I have passed down from a lifetime of a very difficult life. But I make notes everywhere, but I always ask, is it okay if I make notes? Would you mind if I made notes? And if a person says, actually, I don't want you to do that, then you respect that, yeah, so I think it's just, yeah, I think it's how I really like that. That was really lovely what you said. And yeah, there were some very powerful things that you talked upon there. And I think trauma-informed care is a very big one and a big topic actually that I'm sure we would all get very involved in. And I would love to hear everybody's perspective on it. It's an area that I'm very passionate about not re-victimizing and re-traumatizing the people that we work with. And yeah. Does that? I've gone off on a bit of a tangent there. Does that help? But I was just, it's just, yeah. Does that help? Are you still there?
I don't know. Oh, it's me. It's okay. Okay, I think she's come back, and then now we will wrap up. Thank you very much, everyone. We have explored the profound individuals and collective consequences of gender-based violence, from health and well-being and to education, equality, and social cohesions. We have also heard violence is more than, and we know that gender-based violence is more than women issues. So thank you so much, Petrina, for your powerful and deeply insightful contribution. Once again, and your perspective has brought a vital human dimension to our discussion today. Remind us that gender-based violence is not just a policies issue, but a live reality that demand huge and compassionate and informed actions. Thank you very much once again to everyone. And I think that Women Ascension say that we can take an appointment for June, because this is a very, 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 very large topic. We can stay here up to tomorrow and we will not finish to talk about it. So thank you very much to all of you. And I said next time for the next session. Thank you. Bye-bye, everyone. Bye, Petrina.
Thank you so much for having me. Thank you very much, everybody. Thank you.
Bye-bye. Bye-bye. Bye-bye.
Thank you, Petrina. Thank you so much.
Thank you so much.
Bye-bye. Thank you.
Oh, goodbye. Thank you very much.
Thank you very much.